Welcome to Science, Health and Healing, Encyclopedia of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Children's Mental Health, What Can Parents Do? Part 10. Food allergy. How bad is the problem? Excellent scientific studies have repeatedly shown that 1 out of 2 children now in the world suffer from eczema, asthma, or significant immune disorders. I can tell you from my experience as a pathologist, as a researcher who developed and patented, along with Dr. Narayanan of Columbia University, the first microELISA test for the diagnosis of food allergy, that all children with eczema, asthma, and persistent immune disorders have some form of food allergy. I might also tell you that the Department of Pediatrics and Immunology and Epidemiology at Mount Sinai School of Medicine, New York, have been looking at the rising incidence of food allergy among children. And every 5 or 6 years, they publish the data, and there has been doubling of the rate of food allergy among the children that they study. Now they say we do not know the cause, which I think is amusing. For them to ask this question, from my perspective, is amusing. Our children are soaking in the toxic pool of chemicals. Environmental chemicals weaken the immune system and further increase the clinical manifestations of food allergy. What impact does the genetically modified crops have on the rising incidence of food allergy, especially among children? I can't give you a definitive answer, but the circumstantial evidence is very strong and points to the fact that greater the exposure of children to genetically modified foods, greater the risk of food allergy. Now I'm going to return to the subject of children's mental health. What can parents do in the context of food allergy in 2 additional segments? In one, I focus on the relationship between asthma, eczema, and related immune problems, allergic problems, with clear roles of food allergy in them to the brain function. In the second segment, I will focus on food allergies which affect you in the bowel and in the liver and in the blood and create irritability, distractibility, difficulties with learning, mood problems, concentration problems, brain fog, but not associated with overt food allergy in terms of skin eczema, sinusitis, or asthma. I want to close this short program by telling you that the concept of brain allergy that allergists and immunologists have been laughing at for decades, I can tell you from personal experience, the laugh is on them. Because the recent evidence clearly shows that food allergy is related to mental dysfunction. Why shouldn't it be? Allergy reaction cause acidity, and acidified brain cells do not work well. Allergy reactions cause free radical stress, and free radicalized brain cells do not work. Allergy reaction cause release of histamine and related compounds, and those compounds insult the brain cells. So it doesn't really need a wide stretch of imagination to realize that those acidity reactions, free radical reactions, histamine-like reactions triggered by food allergy would adversely affect the mental health of a child. Please forward this YouTube segment to your contacts. Join us in our mission to provide authentic information for children worldwide, their parents, grandparents, and teachers. Information that is authentic, free of cost, free of corporate deceptions, and free of ideological distortions. Thank you for joining me. Please look at other segments of this channel. Children's mental health. What can the parents do? Thank you.